Hi, good morning. My name is Sonia Martinez. I work at ECRMC Oncology and Hematology Center. I am Dr. Razak's medical assistant. Well, medical assistant is like the doctor's right hand. We assist them with the consults. We translate for patients. We're kind of like patient advocates, like right next to the doctor. We do follow-ups, prescriptions, pretty much referrals to CRCD. Anything that the patient needs, we're there.
My name is Annika Agundes, and like Sonia, I am Dr. Razak's medical assistant as well, and I work here at El Centro Regional Oncology, Hematology, and Infusion Center. So some of the challenges, especially for the patients that we have here in the Valley, many of the patients are elderly. They, like my coworker was saying, they sometimes don't have transportation, sometimes they live alone, they have to cope and deal with their diagnosis on their own. And the way we assist them, we try to give them as much support as we can, and if not, CRCD is always there, and they've been a lot of help for the patients. They help them with financial, emotional, pretty much everything that they need. As far as us, what we offer the patient is regarding with, like she said, their symptoms. We try to mitigate whatever we can do, call in prescription medications if they need it. We are mediators for the patient, for the doctor, to try to get their care assisted. Sometimes patients come with a certain idea. They don't always get diagnosed here with us. They already come from the primary care doctor or the other specialist with a diagnosis, and it's very it's common that they don't know what to expect. They're scared. They think cancer, and they think they're gonna die, or that the treatment is just gonna make them feel worse. So we're here to, and as well as CRCD, to educate the patient, to let them know that they're here to get the best outcome of their diagnosis. Makes me feel like I have support in my job, that I have someone that can assist me. Sometimes if for some reason I'm not able to get through to the patient, or since we do have a lot of patients here, there's only so much we can do at the moment for the patients. It's always great to have them to carry on with what comes next, or to follow up with the patients.
It makes me feel emotional, that's for sure, because I see them cry and I'm like, oh, like it's breaking my heart. But if they're by themselves, or let's say they have a caregiver, that they're not there for that patient like 24/7, I try to be as brave as I can. Like, you know what, don't think the negative. I always tell them that. Think the positive, be positive about it. If your cancer is curative, you're gonna beat this. We're here for you. We're not gonna leave you alone. So you can tell that their face and everything changes. We also tell them, we have this CRCD cancer, this program, or these people that help us out. Can I refer you over? And most of the patients are like, yeah, please do refer me. So it's good to have them. One of the ones that really hit me is when I saw a friend of mine that she didn't want to tell her family about it. But I told her, like, you know what? You're putting me in a position that, let's say the day of next week or tomorrow, something happens to you and your family knows that I knew about it. I don't want them to get blamed for it. So I guess that kind of opened her up a little bit in talking to her family about it. Any diagnosis, especially with cancer, no one is alone. No one is alone. As my coworker is saying, and we're here for the patients, as well as CRCD is here for them. The doctors are here, nurses are here. So don't ever feel like, oh, I have cancer, I'm gonna die. No. There's hope, and we'll work with that.
I try to handle it the way I would if it were a family member. You try to stay strong to give them strength. You do get emotionally attached, but you're only supposed to get emotionally attached to a certain point to not lose your professionalism. So just, I don't know, it just comes with the job, I guess. You just find strength wherever you can, hope, and just try to be humble and kind to the patients. People don't know that these agencies exist, so I don't know, I guess always ask your medical professional or healthcare professional if they know of someone, so that they're able to be referred and guided to go to the right place to get their help, support that they need. When we mention to our patients that there's this agency, there's this group of people that are always willing to help them, we do let them know that it's completely free, and that they're able to assist them in everything they need, especially insurance. Patients sometimes don't have insurance, and then we let them know that they can assist them with that as well.